In the era of artificial intelligence, big data plays a vital role in almost all meaningful automation and artificial intelligence applications. Big data has enabled radical innovations in healthcare. How can we ensure medical data are of high quality before they are used? Answering this question is the main mission of Big Data Center at China Medical University Hospital, CMUH. Let's consider the journey of patients with chronic kidney disease, CKD, for whom considerable volumes of health data are generated daily. Enabling the full use of this data can make a critical difference to patient outcomes and the development of new care models. For example, acute kidney injury AKI and CKD were previously considered to be separate pathogenic mechanisms, but recent evidence suggests that AKI modifies the course of CKD. However, a new care model is not yet established, and the scale of community-acquired AKI remains unknown. To address this fundamental issue, medical big data is promising. The first step is to ensure high-quality data are obtained that can capture a patient's full journey. The key point of the data quality assurance strategy at our Big Data Center are as follows. Compiling comprehensive and accurate medical data is fundamental for any application of medical big data. We have established an audit team of professionals from different specialties, including medical IT engineers, clinicians, lab technicians, and biostatisticians. Our audit team can ensure our data inventory is complete and the data we own are correct in the aspects such as data format, value range, and temporal constraints. We have also developed a data validation pipeline that incorporates domain data cleaning. In addition to ensuring uniformity and conformity across all medical data systems and sources before the integration of the master data, we further clarified consistency of the lab data with the lab methodology at a given time. This is impossible without domain expertise. More crucially, we focus on traceability, a critical characteristic of big data that relies on connectedness, not only in internal data, but also in external data sources, particularly for national-level health data. For example, the CMUH renal cohort from patient data obtained from CKD, hemodialysis, peritoneal dialysis, and kidney transplant databases provides an efficient platform for rapid hypothesis testing, particularly when national health insurance data can be traced, which allow us to obtain new insights into entire disease continuum, from subclinical to clinical manifestations, and from undiagnosed to diagnosed statuses. Big data completes the full cycle of the so-called nephrologist learning health system that embodies learning throughout the delivery of care to improve healthcare quality and reduce costs. Discussions about dialysis initiation and the modality choice with patients with CKD remain an experience-based process. By harnessing medical big data, we could track all patients' eGFR following their pre-ESRD registry re-enrollment and calculate the first-year eGFR variability in different scales, such as coefficient of variation and percent change. We revealed that the first-year variability of eGFR following pre-ESRD enrollment is useful in risk assessment for patients with CKD. We further developed a risk matrix among these variability scales and adverse outcomes, including progression to ESRD and acute coronary syndrome. At our hospital, we have been testing its clinical practicality and have embedded this risk matrix into outpatient EHRs to provide real-time risk assessment for clinicians and patients.
Starting in 1995, Taiwan has instituted a national health insurance system with mandatory enrollment that achieved coverage of up to 99% of residents in Taiwan. This 23-year national single-payer claim database with a robust infrastructure facilitates a big data ecosystem. Moving forward, in 2014, the National Health Insurance initiated My Health Bank project. That is a personalized cloud-based service that enables people to check their medical records from the past 3 years on their own smart devices. This generates an opportunity to create a new kidney disease care model.
We developed an app called iKidney to maximize the usage of these personal medical records to a more proactive virtual assistant. Users of this app form a unique CKD community, allowing the comparison of health statuses and the provision of monthly health status updates for users. This gaming-related approach encourages patients to adopt a healthier lifestyle if they are aware that they are in the lowest 25% in terms of health status ranking. This app also provides several dashboards that help patients understand how to use healthcare resources. Recently, we have also been developing a chatbot to collect patient-reported outcomes.
To further leverage the power of big data, we combine the environmental data such as temperature and the PM2.5 with both hospital EMR and the National Health Insurance database.
Big data holds the key to identifying factors that prevent CKD, for example, AKI modifies disease course, and exploring new care models for this disease. More crucially, big data provides a more precise estimation of disease burden and shifts CKD care focus from pre-ESRD treatment to personalized CKD prevention. Evidently, with the add of novel technologies such as AI, big data can maximize financial and personal resources in the modern healthcare system and substantially improve healthcare.